All right, so what are epinephrine and norepinephrine? So we did cover norepinephrine a little briefly, but let's talk about these more. So the thing is that epinephrine is actually derived from Greek root words, whereas the thing is that adrenaline is actually the same thing. Adrenaline you might actually be familiar with, like when you hear about getting an adrenaline rush or with something that's exciting or something that's intense. So adrenaline comes from Latin, and the interesting thing is that they both not only are the same chemical, but they both mean the same thing. So adrenaline is Latin for being above the kidney. Same with epinephrine, like epi meaning outer and above. So nephron refers to the kidney, so it's saying above the kidney. So norepinephrine is the same thing as noradrenaline. So again, epinephrine is the same thing as adrenaline, but again, this is where you have to be very, very careful. Norepinephrine is not the same thing as epinephrine. They are two different chemicals. They're related, they're similar, but they're not the same. So the thing is that norepinephrine, if you look at the chemical structure right here, don't worry about memorizing the structure. Again, some of you haven't had even chemistry, much less organic chemistry. But epinephrine, it's a different structure. It has this methyl group right here. So they're not the same chemical. They do not have the same binding. They don't activate these receptors at the same level or have the same intensity of their effects. So they are different despite looking very same and being very similar in their name. Actually, they're both derived from dopamine. That's the interesting thing too. Okay, so then talking about these receptors. So alpha adrenergic receptors, there are two types, alpha 1 and alpha 2. And beta adrenergic receptors, there are three types. Again, at least the Martini book puts it as a footnote. But this is the thing, epinephrine and norepinephrine can theoretically, or they do bind to all of these. So if you release a bunch of epinephrine into your circulatory system or norepinephrine, it's going to hit all of these receptors. Now to show it visually, again, if you like that sound being mnemonic, don't think the bean part is exclusive. Here we have epinephrine and norepinephrine, again similar but not the same. Here we have the 5 types of alpha and beta adrenergic receptors. Epinephrine can bind all 5 of these receptors. So can norepinephrine. It's not exclusive. So again, that being mnemonic refers to just all of this taken together. It's not an exclusive one-to-one relationship. And this is okay. So for knowing where these are, so the interesting thing with alpha 1 receptors, what they do, when you have an alpha 1 receptor on a blood vessel, what it does is causes the blood vessels to constrict. So a mnemonic you can do with your hands. So well, I have to kind of do this because I have to mirror it. So if you have alpha and you have 1, and then it constricts. Alpha 1 constricts the blood vessels. And then alpha 2, so let's see. Or actually, now let's go to parasympathetic neurotransmission. So now let's talk about the preganglionic neuron and the postganglionic neuron. So again, both the sympathetic and parasympathetic, they have preganglionic and postganglionic. Now, what we have here at this synapse between the preganglionic and postganglionic is surprisingly the same thing. Remember, these are not going to cross-react because the nerve fibers for sympathetic are not the same nerve fibers and spinal nerves as the parasympathetic nervous system. But this is easy. So between the preganglionic and postganglionic, whether it's sympathetic or parasympathetic, you have the preganglionic releasing acetylcholine. This binds to nicotinic receptors. This activates and causes action potentials in the postganglionic neuron, which releases acetylcholine, and this binds to muscarinic receptors. So it's actually the sympathetic part is much more complex than the parasympathetic. Parasympathetic is pretty easy. So what do you have? The same neurotransmitter in both. You just have different receptors at different synapses. So the mnemonic for this is PANAM. So P meaning parasympathetic, and this AN part referring to this synapse right here, where you have acetylcholine activating nicotinic receptors. AM referring to the acetylcholine binding to muscarinic receptors between the ganglionic neuron and the effector and target organ. All right, so nicotinic and muscarinic. So the thing is that if you might be like, hey, nicotinic sounds like nicotine. And yeah, that's how they initially discovered this receptor. They found that nicotine from tobacco activates this receptor. So nicotine is a ligand for nicotinic receptors. Acetylcholine is also a ligand for nicotinic receptors. And muscarine actually, I believe it comes from some species of mushroom. They have a compound that came from that, and they found that activated the receptors. But in your parasympathetic nervous system, the natural one that activates these receptors are both acetylcholine. So nicotinic receptors are many diverse types. Do not worry about it for this class. If you've taken a cell molecular biology class or if you're a senior, there are many of these protein subunits. It gets very complex. Don't worry too much. Muscarinic receptors, there are multiple types. There are 5 types, but I think that's more appropriate. Knowing the difference between the 5 types is more appropriate for maybe your advanced anatomy and physiology or nursing classes. But this is what I definitely want you to know. They both are found in the parasympathetic nervous system. They both bind to acetylcholine.